Good morning. I'd like to call the November 17th meeting of the Wicomico County Council to order. If we could, we'd like to start with the opening prayer and the Pledge of Allegiance. And if you would, please join us. Our Father, who art in heaven, hallowed be thy name. Thy kingdom come, thy will be done, on earth as it is in heaven. Passes, as we forgive those who trespass against us. And lead us not into I pledge allegiance to the flag of the United States of America and to the republic for which it stands. Ms. Hurley, would you please read the items on the consent agenda?
Good morning, Mr. President, council members, ladies and gentlemen. On the consent agenda this morning, you have legislative minutes from November the 3rd, 2020, open work session minutes from September the 25th, 2020 on the discussion of the new public safety building, open work session minutes from October the 6th, 2020 pertaining to the DAF storage tanks moratorium, open work session minutes from October the 20th, 2020 on the discussion of the new public safety building, and open work session minutes from October the 20th, 2020 regarding the letter to the Liquor Control Board on selling beer and wine at liquor dispensaries.
Thank you. At this time, I need a motion to approve the consent agenda for the minutes, and a second.
So moved.
Got a motion by Mr. McCain. Do we have a second? Second by Mr. Holloway. Any discussion? All in favor of the consent agenda, please say aye.
Aye.
Any opposed, say nay. The chair votes aye. Ms. Harley, the consent agenda passes unanimously. Mr. Taylor.
Good morning. I have two items today, but they're at separate times. The first one is public hearing on legislative bill number 2020-18, an act to extend the moratorium on the issuance of building permits for a tank to be used to store waste byproduct, DAF material, of the treatment of wastewater pursuant to Wicomico County Code Chapters 225, 125, and 128.
Okay. At this time, we're going to open the floor to a public hearing for legislative bill number 2020-13. Do we have anybody here to speak on the legislative bill? If so, please go to the podium and state your name and your county. And please limit every comment to 3 minutes. The podium's over there.
Thank you very much. I'm Madeline Adams from Salisbury. I am appearing today on behalf of the Wicomico Environmental Trust as its Board of Directors President-elect. WET supports the proposed extension of the moratorium on granting permits to build DAF storage tanks in Wicomico County. Furthermore, WET urges the council to use the breathing room offered by the moratorium to expand the permitting process to incorporate consideration of public and environmental health. Currently, there appears to be no mechanism for zoning staff or other county officials to review projects proposed for agricultural land for public health and environmental health risks. As the size of proposed projects has grown to massive scale, the risks to the health of neighboring residents and to air, land, and water quality in the county have become extremely serious. The county government and the public bear a potentially huge liability for mitigating the harm to public health and environmental health caused by failure of these massive facilities, or sometimes even by their normal operation. WET therefore urges the county to use the time afforded by the extension of the moratorium on permitting of DAF storage tanks to address the potentially huge liability and to incorporate into the permitting process consideration of public health and environmental health. Thank you for your consideration of WET's opinion.
Thank you. Yes, ma'am.
Good morning. I'm Carol Donahue from Whitehaven, and I spoke at the October 6th meeting about concerns regarding the tank that has already been constructed and in the support of the moratorium. My colleague has already spoken for the Wicomico Environmental Trust today. I'd like to just add briefly that the Friends of the Nanticoke River fully supports this moratorium as well. The tank is in the Nanticoke River watershed, and so the Friends of the Nanticoke River have been very closely following developments on that, along with WET. We think a moratorium is a good judgment for the council to make, and that it has the benefit of allowing further consideration along the lines that Madeline has already expressed. I'll leave it there unless there are questions, and I think that there is another person waiting to talk on this issue out in the hall, so if I need to give my seat up, I'm happy to do it.
Do we have any more questions or comments on legislative or resolution 2020-13? Yes, ma'am.
Good morning. My name is Pamela Olszewski, and I've spoken to you before about the DAF tank on Porter Mill Road. I encourage all the members to vote for the moratorium, for the one-year moratorium. As the people before me have talked about, we consider it a hazard to our health and our well-being. We are experiencing all the things that we expected to experience when we first brought a petition to you and asked you to not let the project go forward. The odor is tremendous, and you never know when and where it will hit you. You can be a quarter mile away one day and not notice it, and the next day you don't want to go out of your house. But from my point of view, the traffic has been the major concern for me and my safety and my quality of life. We are getting tanker trucks all the time. My house is about 40 feet away from the road. At night, 3 o'clock in the morning, it doesn't matter when, they come up and down the road, and it rattles my house. We've had a truck get stuck in the mud, and last weekend, we experienced a truck that overturned. And this is very dangerous. We no longer can walk up and down our road. And we were, in the beginning of this project, we were dismissed by Mr. Burns as the women who walk on the road. And yeah, we walk on the road, and especially at this time when you don't want to go to a public gym, you cannot safely walk down your road. Either it's the odor, but more importantly, it's the trucks. And it's from various companies. And anyone who considers this a farming application or endeavor is mistaken. This is industry, and you can see it and smell it. And our little road on Porter Mill Road has become merely just a driveway for all these tanker trucks. So I hope that you will not only expand the moratorium for the year, but you will go back in and try to find some way to regulate this business so that you set a precedent for other businesses that could come to the county. I have been writing letters. I've written letters to you. I've written letters to you, Mr. Dodd, and I've written letters to the Baltimore Sun. One was published. My recourse at this point is going to be to inform all of Maryland and the surrounding states about how you may not want to come to Wicomico County to live. Because if you can't live in a city or in a town, which we don't have that many of, you certainly don't want to live in the agricultural district, because you could spend $500,000 and be sitting next to something like this tank. With that said, I encourage you to expand the moratorium and to work on the regulation of the one that's existing. Thanks for your time.
Yes, ma'am, thank you very much. Do we have any more comments on Legislative Bill 2020-13? Any more public comments? Okay, this time we're going to close the floor to public comments on Legislative Bill 2020-13. And before we begin the vote, I do want to point out that Councilman Josh Hastings will be joining us from Zoom. He had a last-minute issue where he had to stay home. So at this time, I need a motion to accept Legislative Bill 2020-13.
So moved.
Got a motion. Do we have a second?
Second.
Second.
Got a motion and a second. Any discussion? Any discussion? All in favor of Legislative Bill 2020-13, I'm going to have a roll call. Vice President John Cannon.
Aye.
Councilman Josh Hastings.
Aye.
Councilwoman Nicole Acle.
Aye.
Councilman Joe Holloway.
Aye.
Councilman Ernie Davis.
Aye.
Councilman Bill McCain.
Aye.
The chair votes aye. Legislative Bill number 2020-13 passes unanimously.
Mr. Dodd, my other item is further far down on the agenda. I'm going to step out where I'm live streaming a MACO conference, and if I'm not back in time, send the Marines.
Sure, thank you. Ms. Hurley.
All right. I have one announcement to make before we continue, and that is there's one change to the agenda. The closed work session on consult with legal counsel will not be held today. So looking at the agenda, next we have a public hearing on resolution number 122-2020. This is approving a use agreement between Eastside Youth Sports Council and Wicomico County, Maryland, for property known as the Eastside Youth Sports Complex in Willards, Maryland. A public hearing notice was posted on the county's website and published in the Daily Times stating that a public hearing would be held this morning at 9 a.m. And we have Mr. Steve Miller here, Director of Recreation, Parks, and Tourism, if there are any questions.
Okay, at this time we're going to open the floor to the public hearing. Are there any public comments for resolution number 122-2020? If so, please go to the podium, state your name and county of residence. Do you have any public comments? Okay, at this time we're going to close the floor to public comments. I need a motion to approve resolution number 122-2020.
So moved.
Got a motion, and I need a second.
Second.
Got a motion and a second by Councilman Ernie Davis. Any discussion? All those in favor of resolution number 122-2020, please say aye.
Aye. Aye.
Any opposed, say nay. Chair votes aye. Resolution number 122-2020 passes unanimously. Ms. Hurley.
Next is resolution number 123-2020. This is a public hearing on approving a third concession agreement amendment between Wicomico County, Maryland and Seventh Inning Stretch LP for the Arthur W. Purdue Stadium. A public hearing notice was posted on the county's website and published in the Daily Times, again stating that a public hearing would be held this morning at 10 a.m. And we have Mr. Chris Bitters here, General Manager of the Delmarva Shorebirds, and Mr. Steve Miller, Director of Recreation, Parks, and Tourism.
Okay, at this time, we're going to open the floor to a public hearing for resolution number 123-2020. If you have any public comments, please state your name and county of residence. Do we have any public comments? Okay, with that said, we're going to close the floor to the public hearing. Need a motion to approve resolution number 123-2020.
So moved.
Got a motion by Mr. McCain. Do we have a second?
Second.
Got a second by Mr. Davis. Any discussion? Any discussion? All those in favor of resolution number 123-2020, please say aye.
Aye.
Any opposed, say nay. Chair votes aye. Resolution number 123-2020 passes unanimously. Ms. Hurley.
Next on the agenda is the swearing in of our District 2 Council Representative, Nicole Acle. And we have the Clerk of Circuit Court, Mr. Bo McAllister, here to do the swearing-in ceremony.
Okay, if we could have Miss Acle and her family meet at the podium. And Bo, you can go wherever you want, as long as you keep your distance. Yeah, you can, yeah. I can't
You
hear
want to
you.
use,
Yes,
You can
yes,
use his-
absolutely.
you want to use this table?
I was gonna say, am I a record breaker?
You can speak loud so that
Yeah,
speakers can hear
You
you.
can move that podium mic.
oops.
Alice's are rearranging things.
Diligently and faithfully,
Diligently and faithfully,
without partiality or prejudice,
without partiality or prejudice,
execute the office of count.
At this time, I'd like to congratulate Miss Acle on winning her election. Miss Acle, do you have a statement?
Thank you, President Dunn. I'd like to begin by thanking my friends,
Thank you, Mr. McAllister.
my family, and the citizens of District 2. Without them, I would not be here. I look forward to continuing to serve. Since the first day I took office, equitable education, civic engagement, and public safety have been the cornerstones of my agenda. Today, I renew that promise. As I stand before my fellow council members and council administration, I am reminded of how exceptional and extraordinary you all are. Business leaders, law enforcement, fire captains, and EMS are just a few of the hats we wear. Our diversity and experience brings a unique perspective to the council and insight in governing this body. As I join the 6 council members at the table, we are reminded this is a body of one. We have overcome many challenges this year, but our county is strong and this body is strong, and we will move forward. Thank you.
Thank you.
Excellent.
Congratulations again, and thank you to your family for attending. Thank you. At this time, we need to adjourn from legislative session and enter into the County Board of Health. I need a motion.
So moved.
Got a motion. Do we have a second?
Second.
Have a motion and a second. All in favor, please say aye.
Aye.
Any opposed, say nay. The chair votes aye. Okay, this time we should have Miss Lori Brewster. Good morning. If you would, state your name and position for the record.
Lori Brewster, Health Officer for Wicomico County. So good morning, everyone, and congratulations, Ms. Acle. I provided you all with an outline of what I intended to discuss today, and if you all would allow me, I would like to start from the bottom and work my way up. Looking at our opioid updates across the country as well as in Maryland, we are seeing an increase in the numbers of opioid-related overdoses, which is very concerning. We have had similar numbers in Wicomico County to what we had last year. We have not seen that significant spike. But we are constantly looking at the numbers and being aware of what is occurring. I will say that the trends look to be that people are not accessing the emergency department, nor are they accessing EMS to the point that they were doing previously. So we know that overdoses are still occurring, so we are monitoring that, and we have done some service expansion in this time of COVID, making sure that our peers are available to respond out in the community if there is an overdose, to provide naloxone education and distribution of the naloxone. Oh, I thought you had a question, Mr. Holloway. We are still looking at grant funding, and we have received some grant funding throughout all of this. So we continue to receive grant funding from the Opioid Operation Command Center that funds our opioid intervention team that's local. It helps fund our opioid coordinator in Wicomico County, as well as the Go Purple campaign that occurred in September. It actually occurs year-long because you can't stop. It also is focusing on a media campaign so that we can get the word out on opioids. And it also funds a United Way art campaign that has been in progress for about 4 years. And what that does, if you're not aware, the middle and high schools are able to develop a print media artwork or a video, and then it is put out for individuals to review, and they are awarded funds for the top winners. We also have received an Overdose to Action grant in which we are hiring caseworkers to assist our opioid coordinator in getting out and assisting individuals and organizations in their response to the opioid epidemic. We have a grant. We were one of the first ones on the shore to receive the LEAD grant, which is the Law Enforcement Assisted Diversion Grant. So we are working with law enforcement in trying to divert some of these individuals that are committing some minor crimes from the legal system and getting them into treatment. So we're hopeful that that will kick off here shortly. We are receiving chronic disease funding through our local health improvement coalition that Ms. Acle serves on as the co-chair. And that focuses on diabetes and diabetes prevention activities. With that, we also worked with the hospital on a HSCRC grant that was to focus on diabetes. We did not receive those funds, but we did receive funds, we being the hospital and the 3 counties on the shore, to focus on behavioral health initiatives in the jurisdictions doing some crisis work around mental health and substance use. And most recently, we are the recipients of a hub and spoke grant. So we in Wicomico have the methadone program and our other medication-assisted treatment programs. And with that, we are able to help those other programs that don't have those services in answering questions and providing guidance. And if they are seeking primary care, we can help link them up with those services. So those are some of the grant funds that we have received. I do want to say that all of our public-facing services in the health department are currently being provided. We are still closed to the public, but we have appointment-only services even for our birth and death certificates. So we are providing a lot of services virtually, particularly our behavioral health services, but we have reopened for most public-facing services. So any questions on that?
Do we have any questions? Ms. Acle?
I do have one question on the smoke cessation program. Does that include vaping?
Yes.
That's a
Pardon me?
That's I guess not really up and coming. It's been around for a while, but I see it more in youth.
Yes, we do a lot of education and outreach on all types of tobacco and nicotine use, which includes vaping.
Any more questions? Ms. Brewster, you mentioned something earlier, and since COVID, I guess around March, we haven't heard a whole lot about opioid overdoses, and I think you stated that the opioid users are not using EMS and the emergency room. If that's the case, how are you keeping track, and how do you know that we're still having so many overdoses?
So we work very closely with law enforcement, and law enforcement does a lot of response out in the community to overdoses. So we get those numbers. We also get numbers of naloxone administration. So individuals that have naloxone and they use it on another individual to save their lives, that is reported back to the health department. So we're getting that information as well.
Okay. There is a shelf life on naloxone. Is it a year like most medications?
It is, but the FDA can expand that, and we also have naloxone in the health department that we can exchange expired naloxone out for individuals.
And that would have been my next question. You do have an exchange program?
Yes.
Okay, for naloxone?
Yes.
Okay, thank you. Any more questions? Okay, Ms.
Well, I have COVID.
We've been waiting.
So our numbers today have gone up again, as well as the state's numbers. We are at a 6.9% positivity rate in Wicomico County with a 27.6 case rate. So the positivity rate is over a 7-day period, and that is the percentage of individuals that have tested positive divided by the number of individuals tested over that 7-day period. The case rate is the number of individuals that have tested positive It's the number that have tested positive out of 100,000. So it's basically looking at, if you have 100,000 population, how many of those individuals tested positive. The numbers that seem to be escalating rapidly is the 25 to 44-year-olds. They are up to a 10.86% positivity rate, which gives me grave concerns. The other population that has skyrocketed over the past week is the 15 to 25-year-olds. They are up to 7.14% positivity rate. Our hospitalizations have increased. And I will say that according to the state's numbers today, they have well over 2,100 positive cases in the last 24 hours, which is the second highest since we began testing for COVID in the state of Maryland. In Wicomico County specifically, we had been testing about 150 to 200 people per week at the health department on Carroll Street. We were hearing from the urgent care centers as well as the emergency department that everybody was being overwhelmed with requests for testing. The call center at the health department received well over 200 calls yesterday for requests for testing. So we worked with the hospital. We've expanded testing to include Tuesday mornings. So they are testing this morning as well as all day tomorrow. We filled up both dates very early this week. So we have actually added another day of testing on Thursday. There are other sites in the county in which you can get tested other than the urgent care centers, the CVS pharmacy. Walmart in Fruitland is doing testing as well. We have been working with the city of Salisbury, and we now have an MOU with them to utilize the firehouse ambulance bay for winter testing. As you can imagine, as the weather gets colder, even today it can be an issue, and the ambulance bay at the firehouse is temperature controlled. So if we need to go into that facility, we have that as a drive-through, which the state thought was a very unique opportunity. And
Would that be the station on Cypress Street?
absolutely, yes. And we are doing appointment only, so we shouldn't have any traffic difficulties. Now, I will say the state called me late Friday evening. It's not unheard of anymore. Looking at the possibility of bringing some state-level testing resources to the shore. They are visiting Somerset County tomorrow because Somerset County's positivity rate is steady increasing, and it's higher than most of the Eastern Shore. But they may look at sites also in Wicomico County as well when they're down here.
I saw where the Baltimore Convention Center is being utilized again. Do we have any plans for our Civic Center or any other sites?
It's always an option. There are requirements for indoor testing, and we have not received them locally yet, but it would include air scrubbers and filtration units. And so once we get those guidance documents, we will explore that with Mr. Pasota.
Okay.
Vaccine, good news on that front. We have two very promising vaccines that are coming down the pike. One with Pfizer, that is the ultra-cold vaccine. It has to be kept in ultra-cold temperatures, and that gives me some concern because we have to use it within a 10-day period of time. The other one is Moderna, and that has a little bit higher rate of efficacy than Pfizer, but both of them are 90 to 95% effective in maintaining COVID antibodies at this point. We know that those vaccines will be available to the health department early December, maybe the end of this month, for first responders and healthcare workers. So we have been working in conjunction with Somerset County to develop a vaccine administration program. We don't know when the public vaccine will be available right yet, what we assume probably early spring. We did send out a survey to our first responders as well as health department staff to determine what the desire is of the individuals, if they would be willing to get the vaccine, because we know the surveys in Maryland shows that only 50% of the individuals will get are willing to get the vaccine. So we've sent that out so that we have a picture of what the desire is of the first responders and health department employees. So once we get that information, we'll have a better picture of how much vaccine we'll need. Our current outbreak status leads to a picture of large family gatherings as the culprit for our outbreaks and the rise in our numbers, followed by house parties, and then large outdoor events. People are not wearing masks outdoors because they feel comfortable because they are outdoors, but they are not social distancing. Compliance, the governor during his press conference was really hammering on compliance with the orders. I will tell you that our call center as well as the state's tip line is receiving multiple complaints on a daily basis, and they come directly to my phone. So we have responded to over 100 food service facility complaints related to the lack of social distancing and mask wearing, and well over 200 general complaints in the community related to non-food service facilities not complying with the governor's orders. There are penalties for non-compliance under the governor's orders, but they're criminal penalties. So if you think about having to take a case to court for somebody not wearing a mask with the potential for a year in jail and a $5,000 fine, that's a little difficult. So we're looking at what other jurisdictions are doing, and they are instituting civil penalties for the non-compliance. I have one organization in this jurisdiction that I have received 7 complaints on for not wearing a mask or social distancing while inside the building. We generally go out a couple of times and provide education on the governor's orders and ask them to please comply, because we think that education goes a lot further than hammering somebody with a violation order. I guess I would end with people need to wear a mask and they need to avoid large gatherings as we approach the holiday season. We just need people to be safe. I know that there is significant COVID fatigue out there, and believe me, the health department is COVID fatigued as well. We have about 90 people in the health department working inside the building on a daily basis at one of the 2 buildings, because we need that many people to actually respond to the testing that's occurring, to the compliance efforts that we have going on, as well as managing the numerous conference calls and Zoom meetings that we have. So I will stop there. And
Mr. Holloway?
He's in a hurry, yes. Say he's in a hurry.
Well, I saw you. I can tell in the corner of my eye you're getting ready.
That's fine. Qualifications.
Mr. Holloway, if you can speak into your mic.
I gotta push the button on mine. They won't trust me with a hot mic all the time, so I have to push my button.
not-
Anyway, qualifications for people doing the testing. What are the qualifications? I know you said Walmart or some of the drugstores are doing it. Is it the pharmacists there, or there's people, special training people have to do the testing?
So the pharmacists are doing the testing at the pharmacies. At the health department, it is our nursing staff that are doing the testing.
So who else would be qualified other than nursing staff or pharmacists?
They actually have to have the just-in-time training, but it's typically a medical professional of some sort. The hospital, it's their nurses, their physicians, and the pharmacist.
Do you have any testing done where people test positive and they claim they have no symptoms whatsoever?
Absolutely. We have that frequently. And that's what we're seeing in the 25 to 44-year-olds. A lot of them are asymptomatic, and they are taking it home to the rest of their family, and then we have a whole family that is positive for COVID.
You mentioned you had 7 complaints on, you said an organization. Is that an organization, is a civic organization or a restaurant or just a private?
It's a business.
It's a business, okay.
Yeah.
That's
And
fine.
I wouldn't call them out, and I'm.
No, don't do that. That's fine. I think that's all.
Do we have any more questions? Ms. Acle?
I think what you're doing is an amazing job. I mean, our health department has really been on the forefront of this, so thank you. I was wondering what your thoughts are on these air quality filter systems that businesses seem to be putting in as a preventative measure. Is there validity to that?
It depends on the type. If they are getting the air scrubbers, there is some scientific evidence out there that is showing that that is helpful in particularly in enclosed areas.
All right, thank you.
Got one. When you do start doing the vaccinations, how's the outreach going to be done on that? You going to neighborhoods, or just people come to the health department for them, or?
So the state has developed a tier system. So the first tier is for the healthcare workers and first responders, and those were the ones that will get the vaccine, the first vaccine that comes out, so maybe the end of this calendar year. The second would be people that work in the some of the other areas that are impacted by COVID, as well as the elderly. And then the final tier is the general public. We are thinking at this point in our planning process that we would start with a very large event that we have practiced and rehearsed numerous times on how to administer vaccine and or provide medications to the general public, but we never thought that we would have to do this, so we are prepared to do this. And we have a site designated, and we have practiced that. Just don't want to admit or say where that site is at this point. Security, as far as the vaccine goes, would be paramount, and we would have to have law enforcement around in order to provide that service.
I guess my first thoughts come to the rabies vaccination, how you handle them through the county. You go to the fire departments and people, show up at different fire departments. So you've had a little practice giving
Yes.
inoculations anyways.
Yes. And I mean, we have, like I said, we have requirements under the Center for Disease Control, what they call POD, point of distribution plans. So we have to meet the requirements under those plans in order to administer the vaccine.
Ms. Acle?
It's that time of year when my children start bringing home their permission slips for the flu vaccine. And so I was just wondering if there's any outreach in educating citizens on receiving the flu vaccine, because I guess we're in flu season now, but.
Yes, we are encouraging everyone to get their seasonal flu vaccine. We have produced, with the help of one of the local media stations, a commercial that you may or may not have seen about family gatherings and making sure that you get all of your required vaccines.
Any more questions or comments?
A question, yes. Thank you for being here today. With the increase in positivity rates, would you suggest that was indicative of the fact that there are more tests being taken, that we have more tests being given?
Actually, no, because the positivity rate is a rate that is the number of positive cases divided by the number of people being tested. So you would get that same rate regardless of how many people were being tested. If you tested 5 or you tested 5,000, it's the number of individuals that have tested positive. We do know that there's community spread right now, and I do believe that in large part that's related to people that don't know that they are positive, and they're walking around asymptomatic.
What would you say the percentages of the people who are testing positive who actually are admitted to the hospital and become critical cases?
There's fewer of those at this point than there was in the spring, but we have seen an escalation in our hospitalizations within the past 2 weeks, I would say. Our concern has to do with the stretching of hospital resources because we are in flu season. We know that that impacts the older adults. I will not call them elderly, because I feel like I'm one of them, as well as the young children are impacted by flu. So as we get further into our seasonal flu season, we need to have the capacity for hospital beds. And when people are coming down with COVID and needing to go into the hospital, they are taking up a bed in the hospital. But specific to your question, no, we're not seeing the severity that we were seeing in the spring as far as the hospitalized cases, but that could change.
I'm assuming that the vaccine you will most likely choose would be the one that doesn't require the sub-degree temperatures to store, just out of convenience.
I don't know that I will have that choice.
Okay.
It's whatever vaccine is presented to the state of Maryland.
Okay. As is the tier system. I'm assuming you're using the tier system simply because, not the fact that it's an untested, that it's not widely tested, but just the fact of supply and demand. Is that correct?
Correct.
Mm-hmm. What is the success on the therapeutic side of this as opposed to the vaccine?
That's still up in the air, but I will say, I believe the hospital is part of the research project on the therapeutics. So they could probably speak to that better than I could.
Are they finding successful therapeutics?
If you look at the information that's coming out across the country, yes. And I think that may be why we're seeing less severity in the hospitals. But if you look at what's happening in other parts of the country, the intensive care units are being overwhelmed, and in the upper Midwest, they don't have any ICU beds at this point. So that's where we don't want to get.
Okay. On another note, environmental health,
Yes.
I know there was a lot of concern with the governor's new mandates in place, whether or not it was going to compromise Wicomico County's environmental health department with the limited number of resources that we have right now, especially I think out in the field testing. So did you see any compromise there, any problems, any issues?
The compromise could be if I get sick staff. They would have to stay home, just as the general public would. We are one of a few handful of counties that have continued providing environmental health services outside of emergency environmental health services. So we know, as well as you all know, that with the lower interest rates, there's been an increase in real estate transactions as well as new construction. So the volume of work that's out there has increased dramatically. So we will continue to do work out in the field. We will ask individuals not to approach us while we are out in the field so that we can maintain adequate social distance from individuals, because if you can picture trying to dig a hole for a perk test, that can be rather strenuous in some of our soils. But yes, we will be continuing the work in environmental health.
Thank you.
Our in-house COVID monitor that gives us regular updates is joining us by Zoom. Mr. Hastings, do you have a question or a comment? I can't see if you're requesting time to speak.
Yeah, just we'll be brief. Just first of all, I did get I was made aware that individual went to CVS pharmacy who had insurance and got a COVID test, and they received a $1,600 bill, which they said they're not going to pay. Just wanted to put that out and make sure that was aware. I'm not really sure what's happening there, but that was a local CVS pharmacy that happened. The second thing is just a question on do our fire departments have enough PPE and what do we know about in that direction? Do the folks who are responding, first responders, where are they at with regard to having enough PPE?
So we have been stocking up on PPE for all healthcare workers and first responders, and we are trying to access a minimum of 60 days supply of PPE for each organization, including our long-term care facilities, so that they are prepared in the event that we become inundated with cases like out in the Midwest.
Thank you, Mr. Hastings. Yesterday, the governor thanked Hardwire for donating PPE for the first responders. Do you know if Wicomico County received any of those PPEs?
I'm not sure because that was late yesterday, but any PPE that comes in from the state is a donation, so we are not having to pay for that.
Mm-hmm.
Now, our stockpile that we are trying to maintain a 60-day or better supply, we are using our CARES dollars for that, so we hope to have at least a 60-day supply, and some of the long-term care facilities are getting a 90-day supply.
Okay. I enjoy watching college football, and every now and then you'll see a coach get a fine for not wearing a mask on a sideline. And I know we've got individuals playing sports around here, but I haven't been to any events since March. It makes me wonder why the coaches are required to wear a mask, but the players who have an increased heart rate and increased respirations aren't wearing masks as they're running up and down the field and breathing on about 29 other people.
The actual orders say that they should wear a mask unless they cannot because of the strenuous activity. So I don't even know what to say about that at this point, other than they're encouraged to wear a mask. The officials have to wear one because they are not considered doing as strenuous activity as the individuals that are doing the activities.
Right. Okay. Do we have any more questions for Ms. Brewster? Any more questions or comments? Well, thank you, Ms. Brewster.
Thank you.
Thank you for attending and giving us an update. This time, need a motion to adjourn to need a motion to adjourn from the County Board of Health and reconvene into the legislative session.
So moved.
Got a motion? Do we have a second?
Second.
Have a motion and a second. All in favor, please say aye.
Aye.
Any opposed, say nay. Chair votes aye. Ms. Hurley?
Next for your consideration is Resolution Number 124-2020. This is declaring that Spicy Chicken LLC is eligible to receive enterprise zone benefits for property located at 107 Williamsport Circle, Salisbury, Maryland. In order for a business to qualify for the enterprise zone benefits, it must meet one of the two specific statutory requirements, which are that the business must either make an investment in capital improvements of more than $50,000 or hire new employees since it's been located in the zone. Spicy Chicken LLC is eligible for the enterprise zone benefits based on its investment of more than $50,000 in the property located in the zone. And we have Laura Soper here, City of Salisbury Enterprise Zone Coordinator, if there are any questions.
Need a motion to approve Resolution Number 124-2020.
So moved.
Got a motion by Mr. Davis. Do we have a second?
Second.
Got a second by Ms. Acle. Any discussion? Any discussion? All those in favor of Resolution Number 124-2020, please say aye.
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 Any opposed, say nay. Chair votes aye. Resolution Number 124-2020 passes unanimously. Ms. Hurley.
The next item for business is Resolution Number 125-2020, authorizing the acting county executive to accept a grant award from Program Open Space in the amount of $135,000 for a Civic Center exterior renovation and security project. And we have Mr. Steve Miller here, Director of Recreation, Parks, and Tourism.
Need a motion to approve Resolution Number 125-2020.
So moved.
Got a motion by Mr. McCain. Do we have a second?
Second.
Got a second by Mr. Davis. Any discussion? Any discussion? All those in favor of Resolution Number 125-2020, please say aye.
Aye.
Any opposed, say nay. Chair votes aye. Resolution Number 125-2020 passes unanimously. Ms. Hartley.
Next on the agenda is the submission of appointments and/or reappointments to the Wicomico County Personnel Board, Board of Electrical Examiners, Local Management Board, Wicomico Behavioral Health Council, and the TriCounty Council of the Lower Eastern Shore of Maryland. In accordance with Charter Section 315B, the acting county executive has submitted several nominees for confirmation by the county council. For the public's benefit, the Wicomico County Personnel Board serves as the formal grievance review board to hear and decide appeals from any personnel action as defined in the personnel rules, and the board advises county officials on matters concerning the personnel rules and regulations, and reports to the county executive and county council on the operation of the personnel system. The Board of Electrical Examiners administers the provisions of Chapter 138 of the Wicomico County Code, titled Electrical Standards. The Local Management Board is to promote a safe, healthy, and stable environment for Wicomico County children and families. Wicomico Behavioral Health Council is responsible for the planning and monitoring of mental health and substance abuse program. TriCounty Council of the Lower Eastern Shore, their purpose is to facilitate regional planning and development in Somerset, Wicomico, and Worcester counties. Next on the agenda is the approval of the consent agenda for the appointments and reappointments to the various boards and commissions.
Ms. Hurley, will you please read the items on the consent agenda?
On the consent agenda for the appointments to the boards and commissions, we have Resolution Number 126-2020, confirming the reappointment of Michelle R. Miles to the Wicomico County Personnel Board. Resolution Number 127-2020, confirming the appointment of John D. McIntyre to the Wicomico County Board of Electrical Examiners. Resolution Number 128-2020, confirming the appointment of Donald W. Tribeck, Jr. to the Wicomico County Board of Electrical Examiners. Resolution Number 129-2020, confirming the appointment of Adam Smith to the Wicomico County Board of Electrical Examiners. Resolution Number 130-2020, confirming the appointment of Christopher Fedor to the Wicomico County Board of Electrical Examiners. Resolution number 131-2020, confirming the appointment of Michelle L. Hardy as a member of the Wicomico County Local Management Board. Resolution number 132-2020, confirming the appointment of Kimberly Miles as a member and chairperson of the Wicomico County Local Management Board. Resolution number 133-2020, confirming the appointment of Lauren N. Burden as a member of the Wicomico County Local Management Board. Resolution number 134-2020, confirming the reappointment of Paula M. Erdy as a member of the Wicomico County Local Management Board. Resolution number 135-2020, confirming the reappointment of Nicole Griffin Winder as a member of the Wicomico County Local Management Board. Resolution number 136-2020, confirming the reappointment of Lieutenant Richard Wiersberg as a member of the Wicomico County Local Management Board. Resolution number 137-2020, confirming the reappointment of George I. Whitehead II, Ph.D., as a member of the Wicomico County Local Management Board. Resolution number 138-2020, confirming the appointment of Lori Brewster as an ex officio member to the Wicomico Behavioral Health Council. Resolution number 139-2020, confirming the appointment of Michael Dyer as an ex officio member to the Wicomico Behavioral Health Council. Resolution number 140-2020 is confirming the appointment of Nicole Acle as an ex officio member to the Wicomico Behavioral Health Council. Resolution number 141-2020, confirming the appointment of Michelle L. Hardy as an ex officio member of the Wicomico Behavioral Health Council. Resolution number 142-2020, confirming the appointment of Meredith B. Miller as a member of the Wicomico Behavioral Health Council. Resolution number 143-2020, confirming the appointment of Jason Sammons as a member of the Wicomico Behavioral Health Council. Resolution number 144-2020, confirming the appointment of Melissa Beatty as a member of the Wicomico Behavioral Health Council. Resolution number 145-2020, confirming the appointment of Bishop J. Anthony Dickerson as a member of the Wicomico Behavioral Health Council. Resolution number 146-2020, confirming the appointment of Christina Bates as a member of the Wicomico Behavioral Health Council. Resolution number 147-2020, confirming the appointment of Catherine Smith as a member of the Wicomico Behavioral Health Council. Resolution number 148-2020, confirming the appointment of Keith R. Richardson as a member of the Wicomico Behavioral Health Council. Resolution number 149-2020, confirming the appointment of Leslie Brown as a member of the Wicomico Behavioral Health Council. Resolution number 150-2020 is confirming the appointment of Cynthia A. Schiffler as a member of the Wicomico Behavioral Health Council. Resolution number 151-2020, confirming the appointment of Wilmore Sterling as a member of the Wicomico Behavioral Health Council. Resolution number 152-2020 is confirming the appointment of Melanie Craig as a member of the Wicomico Behavioral Health Council. Resolution number 153-2020 is confirming the appointment of Lisa Reniger as a member of the Wicomico Behavioral Health Council. Resolution number 154-2020, confirming the appointment of Drew Vanderwind as a member of the Wicomico Behavioral Health Council. Resolution number 155-2020 is confirming the appointment of Michelle Bradley as a member of the Wicomico Behavioral Health Council. Resolution number 156-2020, confirming the appointment of Nicole Johnson as a member of the Wicomico Behavioral Health Council. And finally, we have resolution number 157-2020, confirming the appointment of Nicole Acle as a voting member of the Tri-County Council for the Lower Eastern Shore of Maryland.
Thank you, Ms. Hurley. This time I need a motion to approve the consent agenda for the appointments and board, to the boards and commissions.
So moved.
Who made that motion? Got a motion by Mr. Holloway. Do we have a second?
Second.
Got a second by Mr. McCain. Any discussion? Any discussion? All in favor, please say aye.
Aye.
Any opposed, say nay. Chair votes aye. Ms. Hurley, consent agenda passes unanimously.
Next for your consideration is Resolution Number 158-2020, authorizing the acting county executive to apply for and accept a grant from the Maryland Family Network, Inc. in the amount of $330,000 for a family support center. And we have Ms. Michelle Bradley here, Director of the Local Management Board. She's actually joining us remotely by Zoom, if you have any questions.
I need a motion to approve resolution number 158-2020.
So moved.
Got a motion by Mr. McCain. Do we have a second?
Second.
Got a second by Mr. Davis. Any discussion?
I have,
Ms. Acle.
That's too close. I have a question on where this, where the facility will be located.
Ms. Bradley?
The proposed site for the facility is the Truett Street Community Center.
So will it be focused just in that particular neighborhood, or?
Yes.
Okay, all right, thank you.
Do we have any more questions for Ms. Bradley? I do have a question, Ms. Bradley. Has the grant already been applied for?
Yes.
It has been applied for, so now we're basically just approving it?
Yes.
Okay. Do we have any more questions for Ms. Bradley? All right, need a motion to, all in favor of resolution number 158-2020, please say aye.
Aye.
Any opposed, say nay. Chair votes aye. Resolution number 158-2020 passes unanimously. Mr. Taylor.
Yes, thank you.
Thank you.
Thank you, Ms. Bradley.
Thank you. This is my second item. This is a continuation of the second reading on Legislative Bill 2020-09, which, let me get my right page here, is an act to prohibit unauthorized increase in the salary for a position stated in the budget and to establish liability for any excess and sanction for payment thereof by amending the Wicomico County Code to include in Chapter 59 Personnel Rules and Article 5 titled Other Rules and Section 59-23. This was originally introduced in August on the 18th. There was a public hearing on the 15th, and second reading began then. At that time, some concerns were voiced by Mr. Pisotta and Ms. Oland regarding what I guess you would call interim changes during a particular fiscal year in the salary of personnel due to various factors, education, increasing their grade, and so forth. That was the nature of the concern. A couple weeks later, I think it was the 29th of September, Ms. Hurley, I, Mr. Pisotta, and Ms. Olin met to discuss the concerns and to try to formulate some language, which I then proposed. And that's been reviewed by the executive branch, and apparently they're satisfied with it, and it, sounds good to me, so I think we're good to go. There would be an amendment required of the bill that was introduced, but it's pretty simple, and I can just tell you what that is, basically. It's the first sentence of Section 5923, Subpart A, and I'll just read that for you right now so you'll know how it reads right now. It's not real long. The salary for a position of employment by the county shall be the amount stated for the position in the county's budget or in the county charter or code, and may not be increased except by amendment thereof, or as may be required by applicable law or regulations thereunder. The changes that we've discussed and seem to be agreeable would be as follows. I won't read a lot of this, but after the word "except," add in parenthesis 1, so there's a subpart 1, and that would be the by amendment thereof, or right after that, insert in parenthesis numeral 2. So we're talking now about a second subpart, and at the end of that subpart, which is the end of the sentence, add the language "or authorized by a regulation or an agreement made or adopted by the county council for either the personnel system, generally, or for specific personnel." And that language that I just read is to address the situation where something essentially happens during the year after the salary has been set initially. And that's the nature of it. So I think if with that amendment, the executive branch will be satisfied, and hopefully the council will too.
All right, need a motion to approve legislative bill 2020-09.
Make a motion to amend,
I'm sorry.
I'm a little confused here. Have we done the initial to get it on the table?
We're going to do a motion, and then we'll do a motion for the amendment.
Okay.
So we have a motion for a legislative bill.
So moved.
We have a motion. Do we have a second?
Second.
Any discussion?
Make a motion to amend legislative bill 2020-09 as stated, as to how Mr. Taylor.
Thank you. We have a motion to amend section 59-13A. Do we have a second?
Second.
Have a second by Mr. Holloway. Any discussion?
Just a quick question. I know we have Ms. Olin here. So that language, we're comfortable, I mean, that takes care of the example that you were giving earlier, like mid-year, someone, their level changes due to promotion or due to certification or something they receive. So, I mean, it seems to be,
I think it covers the waterfront.
We have Ms. Olin at the table.
Based on our review and discussion with Paul Wilbur, we believe the language references the handbook, and the handbook allows us to do promotions, new hires, and those were our concerns, is that in the standard course of business, if we have sufficient, the handbook references, if you have sufficient funds to be able to handle those changes in your budget, those changes are allowed.
Any more discussion? All those in favor of the amendment as stated by roll call. Vice President John Cannon.
Aye.
Josh Hastings.
Aye.
Nicole Acle.
Aye.
Joe Holloway.
Aye.
Ernie Davis.
Aye.
Bill McCain.
aye.
And the chair votes aye. The amendment passes. All those in favor of legislative bill 2020-09 as amended by roll call. Vice President Cannon.
Aye.
Councilman Hastings.
Aye.
Councilwoman Acle.
Aye.
Councilman Holloway.
Aye.
Councilman Davis.
Aye.
Councilman McCain.
Aye.
Chair votes aye. Legislative bill 2020-09 passes unanimously. At this time, we'll open the floor to public comments. Please limit all public comments to 3 minutes or less. Any presented material may be submitted to the council members. Please include 10 copies. Do we have any public comments? Is there anyone out in the hall with public comments? Okay, I know there were some people here earlier that usually speak. With that said, we'll close the floor to public comments. Council comments. Do you have any council comments? Councilman Hastings.
Yeah, I just want to say real quickly that I saw this morning that the Wicomico schools are going to go virtual through December 18th as of this morning. I know we've had a spike in cases. In coronavirus, we have now more than 2,900 cases. And 55 Wicomico residents have died because of it. I also want to say I have had, since I made the comment, actually I've had a couple of fire department folks reach out. They are expressing their need for PPE now. And I don't know where we stand when it comes to the use of CARES Act money or anything we have left over, but I know we've got to get that spent sooner than later. But we've got a lot of unemployed folks or underemployed folks from because of the virus that are having trouble paying their electric bills, mortgages, or rent or food or things like that. So however we continue to help support that, the better. Thank you.
Thank you, Councilman Hastings. Do we have any more council comments? Ms. Acle? Any more council comments? Okay, moving on to presidential comments. I'd like to thank everyone for attending today. I guess as you know that we won't be meeting before Thanksgiving, so I would like to wish everyone a happy Thanksgiving and want everyone to stay safe during the holiday. Right? Moving on, I need a motion to adjourn to go into open work session.
So moved.
Followed by closed work session pursuant to the general provisions of Article Sections 3-305B1 for discussion of appointment to a position that the public body has jurisdiction to protect the confidentiality of the individual. Who made the motion?
I did.
Got a motion by Mr. Holloway. Do we have a second?
Second.
All in favor, please say aye.
Aye.
A comment, if I could.
Yes, sir.
I noticed that two individuals just came in. I didn't know if they were downstairs waiting for public comments or if they were here for the work session.
They're here for the next work session.
Thank you.
Thank you. All right, and at this time, we're going to have an open work session. Ms. Harley?
And we have the, excuse me, the first open work session we have is a transfer of payroll functions and personnel from the Department of Human Resources to the Department of Finance. And we have Pam Olin here, Director of Finance.
Ms. Olin?
Good morning, I guess it's still good morning. This is a procedural cleanup to make sure the charter matches what the budget was approved as. As the memo states, we believe that payroll makes sense being under finance now. Payroll is a disbursement function. It is probably it is the largest disbursement function we have, except for capital projects within the county. So having that fall under the finance department makes logistical sense as well as oversight sense. So the budget for fiscal '21 had these positions in the finance department, but the legislative act needs to follow to allow this position, and it's actually a transfer of one position. There was one position in HR that basically processed payroll, and that one position is now moving to, or has moved to finance financially, and needs to procedurally move.
Yeah. Do we have any questions for Ms. Olin?
I think this is what was recommended by the internal auditor some time ago, if I'm not mistaken, when Mr. Roser was still here.
I can't honestly answer. I didn't follow it at
just
that
comment.
point.
Right.
But again, as a disbursement function, as the head of finance, I believe it's the appropriate place for it to be.
Right. Some of us always wondered why payroll was in HR, and then we did some digging into it, and as Vice President Cannon stated, it was recommended that it goes back to finance where it makes logical sense.
So I'm assuming we'll need to amend the budget as well as legislative.
No, the budget actually already has the people in these under finance.
Oh, it is under finance. Okay,
Yeah,
good.
so fiscal '21 budget was adopted with this happening.
I got
So
you.
we're just getting the charter to follow the budget.
That's right.
So.
Okay. Any more questions? All right, Ms. Harley?
If there's no more questions, the next work session item is,
Is the next step, this would go to council.
Are we going to have a legislative bill
yes, we
When
would
are we
introduce a
going?
legislative bill at the next council meeting.
at the next council meeting? Okay.
Thank you.
Thank you. Okay, now, Ms. Harley?
Okay, so the next open work session item is overview of the nuisance flood plan. And we have Marilyn Williams here, the land development coordinator, and Lorenzo Cropper, emergency planner.
Good morning. I'm Marilyn Williams, Land Development Coordinator in the Department of Planning and Zoning. I'm here to talk to you about our recently filed nuisance flood plan. This plan came about because in 2019, the Maryland legislature passed a law entitled Sea Level Rise, Inundation, and Coastal Flooding, Construction and Adaptation and Mitigation.
For the record, could we introduce your
Oh,
partner?
I'm sorry, Lorenzo.
Lorenzo Cropper, Emergency Management Planner.
Thank you.
This bill charged the Coastmark Council, which was developed in 2014 by a similar bill, with certain responsibilities in preparing the state for sea level rise and also preventing damage to life and property in the state of Maryland. It also gave the Coastmark Council the responsibility to establish certain guidelines for state-funded construction projects. And it charged the Departments of Planning, Natural Resources, and the Environment with, quote, developing and publishing guidelines to assist local jurisdictions in the collection of data to establish nuisance flooding baselines, end quote. And it was in this section that they also charged any local jurisdiction with nuisance flooding to develop a plan to address the nuisance flooding. We have to update that plan every 5 years, and we have to publish that plan on our website, which we have done under the Department of Emergency Services. The bill did not include a definition of nuisance flooding, but the guidance document established through those 3 agencies defined nuisance flooding as high tide flooding that causes a public inconvenience. And in Wicomico County, that inconvenience is generally roads being inundated by high tides. The state established 3 critical components that the plan needed to include, which was an inventory of known flood hazard areas, an identification of flood thresholds. So at what level, what causes nuisance flooding in Wicomico County is what we needed to tell them. And a mechanism to document the flooding events from now through 2025, when our plan will be updated. So our approach was to, first of all, define what is nuisance flooding in Wicomico County, what causes it, what events, where does it occur, can the nuisance flooding be prevented, and how are we going to communicate upcoming events to the citizens of Wicomico County. And so that's where we developed our nuisance flood plan. We first introduced the world to Wicomico County and identified that it's really road flooding that is our nuisance flooding. Our sources of flooding come from, of course, the Nanticoke and Wicomico rivers and the many creeks and tidal tributaries coming off of those 2 waterways. We, as a baseline, yes.
I mentioned 6 inches of rain within 24 hours. That's our big problem with flooding.
Yes, it is a lot, but in this plan, we are charged with tidal flooding. So that's a whole nother stormwater plan that can be addressed separately. So we identified 3 different levels of flooding: minor, moderate, and major flooding. And again, these are all bases because this is the first time this plan has been established. So we are calling minor flooding less than 6 inches of water in the roadway that recedes within 6 to 12 hours. The good part about tidal flooding is that it is temporary. The tides will come in, they'll flood, and then they'll leave. Moderate flooding, we're calling 6 inches to 2 feet, and major flooding greater than 2 feet in a roadway. Our extreme nuisance flooding occurs with extreme high tides, lunar events. A south-southwest wind is a really strong factor for us in nuisance flooding. It just pushes the water up the bay and up into our rivers and into all of the tributaries. Again, a nor'easter storm does the same thing because it wraps around and pushes the water up the bay. We had to address sea level rise and to at least mention what is sea level rise and how does it affect Wicomico County. So we do live in an area that has been identified as within the next 30 years, we are to expect between 0.8 and 1.6 feet of sea level rise with a 66% probability. And that comes from an extensive state plan that was done. We needed to do our inventory, and we are one of only 2 jurisdictions, I'm proud to say, that actually did everything that we were supposed to do, and I just found this out last week from talking to the girl that reviews the plans. So we actually set what is minor, moderate, and major flooding in Wicomico County. Again, these are just baselines, and we may need to tweak them over time, but we find minor flooding at 1.5 to 2.0 feet of high tide, moderate flooding at 2.0 to 2.8 feet of high tide, and major flooding at greater than 2.8 feet of high tide. And that was based on, we had actually started in the last year kind of going out and documenting some of these events. And using some of the tools that are available to us, we could see what were the tides on these days, what were the winds on these days, that we took pictures of all of this flooding. And so we were able to come up with this as a baseline. We then inventoried our roads, and you can see a table in the nuisance flood plan that lists all of the roads that we have identified as having regular nuisance flooding, what their flooding source is, and any remarks. We then discussed a few mitigation efforts that have occurred or are occurring in a few different areas. And then we discussed how are we going to monitor these flooding events, and then how are we going to communicate to the public. So if you are on Facebook and you saw the Wicomico County Executive's Office posted, we're going to be using a quarterly report by NOAA. And they use all of their data and tell us that on these particular dates, we can expect extreme high tides. Right now, we're going through one of those events until the 20th. And then, of course, we can just put it out there that, hey, these are the dates that are identified, and knowing that if any weather events come during this time period, it will exacerbate the situation. And so we'll communicate through social media. But we also are going to be participating in a new program, and this just came out since we put out our plan. It's called My Coast Maryland, and I have copies of these that I can give to Laura for you. But what this is that the Coast Smart Council came up with a way. We are participating, it's a national program, but now we are participating in Maryland, where if I'm out and about and I see a flooding event going on, I can download this app, mycoast.org/MD. I can download it. I can take a picture. I can upload my picture, and it will, by GPS, be able to tell where I'm at. And then it will add a report on the program. And that report, they will then pull from their own data. They'll be able to say, okay, what was the wind speed at this time, at this location, on this date? What was the rainfall in the last 24 hours? What's the water level right now, tide-wise? What was predicted? We're finding that what NOAA and DNR are predicting in our tides are actually much lower than what we're experiencing often, especially if we have a wind or weather event. So that's going to be a really important tool for us to use, for our plan, and also for the state to use. Now, this plan doesn't really we just get comments back. It's not like a graded plan. It's just something that we had to do, and we haven't gotten our comments back yet, but I did talk to the lady at DNR who does do the comments. They're not even sure what they're going to do with all of these plans. So she's even said that they're just going to be working with it over the next couple of years to kind of figure out what are they going to do, and then how are they going to use the information.
All right. Do we have any questions?
Mr.
Cannon.
First of all, thank you for being one of the very few to turn in this plan. That's great. That's excellent. That's excellent for the county as well.
A lot of people turned it in. They just didn't address that one aspect of saying at what level are you experiencing.
Understood.
So.
I'm assuming the municipalities have to turn in, or are they required to do their own flood plans?
Yes, so our plan is only for Wicomico County, does not include any of the townships.
Okay.
Every single jurisdiction that experiences nuisance flooding was to have done something. So we contacted all of the townships within the county, and if they did not experience any tidal flooding, then they wrote a letter saying, we don't experience that. So then that was their response. The city of Salisbury has their own plan. Sharptown was kind of on the edge, but they decided that no, they only experienced a little bit of flooding in Cherry Beach Park, and they don't really have any roadway flooding. So yeah, all of the townships did what they needed to do, and they informed the state that they don't have any flooding issues.
Just a little different than a comprehensive plan where part of that is incorporates.
Yes, certainly.
Okay.
Any more questions? Ms. Williams, thank you for the presentation. You all did a great job. When did this nuisance plan start?
Well, it was originally supposed to be submitted last October, but a lot of the jurisdictions said that they needed more time, so they extended it to October 1st of this year.
So it's recent.
Yes, and it's, like I said, it's the first one, so we're just going to kind of tweak it as we go along.
Mr. Cropper, does emergency management respond to the flooding incidents?
Yes, we will, if called out.
You have to be called out before you respond, because
If we have knowledge of it.
we were meeting with the previous Public Works Director and getting regular updates on the flooding, and flooding has been pretty severe in Wicomico County. And touching on what Mr. Holloway said, when you have the tidal floods and then you have the storm water coming in, it can be very disastrous. Are you working with Public Works on this?
It really has helped having our engineering department is on the same floor, and we're really working with each other a lot now, and they're addressing more of the stormwater aspects of the non-tidal flooding.
Okay. Ms. Acle? Oh, I thought you were getting ready to speak. I saw your hand on the mic. You have any more questions or comments?
No.
All right, Ms. Williams, Mr. Cropper, thank you.
Good job.
All right, we're a little ahead of schedule, and Mr. Shipley's here. So, Mr. Shipley, would you like to join us for the next work session? Thank you all again.
Thank you.
For the record, introduce yourself.
Yes, my name is David Shipley. I'm the Director of Emergency Services.
Okay, you may begin.
Yes, what I'd like to do, I'm here to, the work session is dealing with Carey's Law. I'd like to give you an overview of Carey's Law, some background, and then the enforcement needs that are associated with it. On February the 16th, 2018, Carey's Law was signed into federal law name for Carey Hunt. Her name was Carey Hunt Dunn. The law was championed by her family after she was killed, and her 9-year-old daughter was unable to reach out to emergency services because she didn't know she had to dial 9 to reach an outside line before calling 911 at the hotel where they were staying.
Right.
It's a big tragedy. Carey's Law requires that any multi-line phone systems will allow callers to reach emergency services 911 without the need to dial a prefix for an outside number. February 16th, 2020 was the compliance date for multiple line telephone system users per Carey's Law. Now, what I'd like to do is talk about Maryland law. In 2015, the Maryland Public Service Act was amended to require that by December 31st, 2017, a person that installs or operates a multi-line telephone system shall ensure the system is connected to the public switched telephone network in such a way that when an individual dials 911, the call connects to the public safety answering point without requiring the user to dial any other number or set of numbers prior to that. Now, because of the law, Wicomico County, what are some of the actions and legislation that we need? In 2020, the Maryland Public Service Act was further amended, and it added these words: a county or municipality shall be responsible enforcing the subsection, which is what I just read about having not having the ability to dial 911 directly. Each county or municipality may set a fine or a series of fines to be issued to a person that violates that subsection, and that's the same thing I just mentioned, the subsection they're talking about. It's important to note, though, that when a county submits a request for disbursements for the 911 Trust Fund, the county shall submit to the board, and they have changed their name to the Maryland 911 Board now, a certification of the enforcement actions taken by the county under this section. So what they're saying there is the county must document enforcement actions for us to access the money that's available for the 911 fees that's collected per your phone bill, and also the trust fund. So the Maryland 911 Board also promulgated some direction. To ensure compliance with the Public Safety Act, the board established the following guidelines on September the 24th of this year. It says, each public safety answering point director, and that would be me in this case, shall submit quarterly reports describing the entity in the county responsible for the enforcement of the Public Safety Act article, the number of multi-line phone systems that were inspected for compliance, the number of violations found, and the reporting shall be submitted to the, on the county letterhead and signed by me, the PSAP director, and I will have to do that 4 times a year if we want to comply and still get the funding through the 911 system. So that's why I'm here today, is to talk about the legislation that's necessary for that. The new article, it's a new Article 4 for Chapter 15 of the Code, and this enforcement legislation needed was proposed by the Office of Law after review and discussions with me.
Proposed by who?
The Office of Law. They're the ones that craft it.
Okay.
Based on the state law and interacting with me also. I'm not going to read, it's in your briefing book all the way, almost at the end, I believe, is where it's at.
Okay.
I do want to hit some salient parts of the law, though.
Yes, sir.
The legislation. A person that installs or operates a multi-line telephone system shall ensure that the system is connected to the public service switch telephone network in such a way that when an individual using the system dials 911, the call connects to the public service answering point without requiring the user to dial any other number or set of numbers. That's right out of the state and federal. It defines it. The new legislation also defines what a multi-line system is. That's in there, but it also identifies the Wicomico Emergency Management Disaster Preparedness Agency. That is the code wording it's in the actual county code for my agency. Shall be responsible for enforcing the above requirements. Officers authorized by the director of the Emergency Management Disaster Preparedness to enforce this section may issue citations for civil infractions of this section. And I use that word may because the goal here is when we go out and do the inspection, the goal is compliance, not to fine people.
Sure.
A person who violates this section shall be guilty of a civil infraction and be subject to a fine not to exceed $250 per violation for each day of the violation occurs. It again will be a civil infraction. The goal for the inspections is compliance, not to fine people.
Can I ask you who would do the enforcement?
It could be myself or anybody in my department.
Are we set up to issue fines?
Yes, the civil infraction, it's mentioned in the law to do it. Okay, it'll be a civil infraction, just like they do, I think, planning and zoning uses it for zoning violations and stuff like that. Yes, and what we would do, and it's ideal for this to be in my department. I'm the one that manages the money that comes in from the 911.
Yeah.
I'm the one that's going to be signing the reports. So simply how you're going to do this is go out to, let's say, a hotel or a motel. You're going to go and identify yourself, and you're going to go up and say, where's your front desk? You can go over to the phone and just simply dial 911 and see if it goes through. You can go to a room and do the same thing. And again, it's suited well for my organization because the days we do this, we would go out and we would tell our 911 folks there's going to be test calls coming.
So the plan is to do regular inspections of businesses in the county?
Yes, I have to file a quarterly report every 3 months.
Yeah, I see the dates.
Yeah, and I have to do that. And again, we jeopardize losing that funding that we get from the Emergency Numbers Board if we don't do that.
Hey, David, quick question.
Mr. McCain.
You just mentioned the hospitality industry, hotels, motels, et cetera. Are they communicated with to be made aware of this? I mean, how would they be aware of this law? And I'm thinking about the fact, they already have an existing phone system that's in place that might have an outgoing line you have to use, like, dialing 9 before you get out. Does it mean they got to change their system, et cetera?
Yeah, I'm not aware of anything. We just really were notified of this, and that's what the legislation is for. Now, they should have realized this, and their phone provider should have told them this in 2017. So it's not something, but I don't recall any publicity campaign or anything like that.
That's what I'm kind of getting at the question, like, if they got a system that's older than, was installed prior to 2017, they may not have this functionality, and they may not be aware of the fact that they need to be making changes.
Well, and it'll be part of what we can do also is put that out when we start this. And then remember, like I had indicated, and the concern would be is our goal when we go out, it would be the education too. If we run into someone that doesn't have it, be prepared to, you need to get back to your phone vendor and
Just
comply.
educate them and make
Yes.
them aware of it.
Right.
Right.
Does the government office building have a phone system where you have to dial a number to get out?
I checked randomly downstairs in purchasing, dialed 911, and it went through.
It did.
But
Okay.
we'll double check that and make sure it's throughout the building, yeah.
Okay, good. Thank you. Any more questions before he moves on?
I don't really have anything.
You don't
on-
have anything else?
No, sir.
All right, any more questions or comments? All right, Ms. Hurley, are we set up for the introduction of the legislative bill
Yes, we can introduce it at the next council meeting,
at the next council meeting? Okay,
December the 1st.
thank you, Mr. Shipley, for this presentation.
Thank you.
All right, we're still ahead of schedule. Guess we can move on, Ms. Hurley, to the letter from the Wicomico County Public Libraries.
In your briefing books is a letter from the chairman of the Wicomico Public Libraries. I'm sure you guys have all read that. My question is, does council want to respond? And can we just open this up for discussion as to how we should communicate with various outside county agencies?
Okay, open for discussion. Mr. Holloway.
I've read the letter, and, if you read the charter, we basically have, we can question pretty much any agency that we fund or partially fund. So I don't understand, what set this off. Maybe there was too many questions asked, but organizations that we fund, we should be able to question how, how they're spending their money, so.
All right, thank you. Ms. Acle, did you have a comment?
I didn't have a chance to read the letter, but my thought is the same with any entity that we fund, similar to the public school. Their board meets with us every 3 months? The Board of Education?
They meet quarterly, yes.
Okay.
Quarterly with those, yes.
That may be an alternative to keep the lines of communication open.
Yeah, I think the letter doesn't challenge the fact that as council members, we can question, organizations that we fund. The letter's more addressing how those questions are presented to those organizations. Like in this case where we have a liaison, we have a council member who serves on their board. The suggestion, or one of the suggestions is that those questions go to that council member so they can relay that to the board, as opposed to an individual council member just, being able to ask unlimited number of questions or request unlimited number of resources or time from these organizations. So, I think that's the main thing they're addressing here in the letter, which I think is a good idea. That's why we have a council representative, for example, like on the library board. If we have a question, let's present it to that council member so they can present it and report back to this body.
Okay, Mr. Davis?
Yeah, I think that's what it pretty much is like, because the council doesn't control the day-to-day operation. I think what they're saying is like, why we shouldn't be going directly to these, like just say the library itself as a council person, directly hitting them with questions and stuff like that. Like Joe said, we still have the opportunity, we still should be allowed to ask the questions, but it should go through, I think, through different channels, either through Ms. Hurley or through Mr. Pasota, who controls the day-to-day operations of the county. And I think, and like even with John, like on the board of the library, maybe he should, notify him. He might not have the answer to it. If you don't, then it should go through that. Instead of us as council people going directly to these departments and giving them a bunch of questions and asking for a lot of stuff that I think it should go through, at least through the county exec, because he does control the day-to-day operations of the county.
And Mr. McCain brought up a good point, too, about the representative from the council being on the Board of Trustees, and maybe if we would get regular updates, maybe that would answer some of the questions that other council members have. And I guess that would go for all commissions.
Yeah, I think I appreciate them taking the time to send the letter. A lot of it, I guess, was part of in the work session that we had, and also when we had a discussion more recently on the resignation of the director. And in that process, during the meeting, I had stated that maybe there is an avenue that we have to look at, whereas there's a purpose where the council doesn't have direct oversight on department heads, specifically because they've tried to, organize a chain of command in some type of a structure. So I just simply threw that out there, that maybe even though we are allowed the right to question departments that we contribute to, funding-wise, that's usually done not through individual council members, but that's also done as a body. So even though the chapter allows us to do it, it allows us to do it as a body. And their concern was whether or not things were getting out of control, where individual council members were being allowed to call them. And evidently, without question, it escalated to serious differences of opinion. I called. I know Joe called. As far as library concerned, I know Nicole called. I know Joe called. I called. I had a long discussion with the director at the time. So again, in order, I think what I guess we would try to accomplish, as well as the library, is to avoid any escalation of differences of opinion, any he said, she said after the fact that goes to such a level that no matter what the concerns might be, you have a director who literally resigns. And we shouldn't be in that position. We wouldn't want to be in that position with the library. We wouldn't want to be in that position with any other, I think, agencies that we deal with. So they're looking more for policy on the part of the council as opposed to anything else. If we have it in place where you do have a liaison, maybe it could be addressed to the liaison. But again, it's their recommendation, and it's up to the council to make that decision.
Right, Ms. Acle.
I agree with that, having some type of liaison, whoever we are going to have. But as far as the resignation of the library director, I mean, we do question entities that we fund. I mean, we question the superintendent. That's not an unusual thing to do. So, I mean, if Mr. Cannon, if you're willing to be that liaison, I think that would, since you're a member of the library board.
I think every member of the council is a liaison to whatever organization they represent, certainly.
But as a body. But as a body, individually.
Well, you're right, even liaisons should make sure that liaison is acting as, is that what you're suggesting?
Right.
As a representative of the body, that's
right.
True.
Right. I wonder, since the letter came from the library, if they would want to join us for regular meetings such as the Board of Education. Mr. Cannon, you serve as a trustee. What are your thoughts on that?
Well, I think without question, I think the library, even when Andrea was here, they always felt like they were always left out. They're a great part of education in the county, and they always felt that that they had not really gotten the attention just as was needed. Can you check with them to see if they would like to meet with us regularly? Yeah, I can do that. That'd be very easy to do. I'm sure they'd be very willing to do. They had suggested in their letter that they would offer coming before the council at any time. So, we'll firm that up.
If they did meet regularly, the council members that had questions could probably direct it to them at that point.
Yeah, nothing wrong with that at all. It's a good idea.
Do we have any more comments? Mr. Hastings, I can't tell if you...
So, excuse, I have a comment,
Oh,
excuse me. So what's the difference?
Mr. Holloway.
What's the difference in directing questions to the library in a public setting like you just mentioned, and directing questions to the library by making a phone call or asking a question through an email? What's the difference in that?
I'm not going to speak for or against it. I can only give you my opinion. I think as I said before, it helps you avoid any type of perception of escalation of, I wouldn't say aggressive differences of opinions, because that's honestly, I think, what was implied here. but you can avoid that whole perception if you're going through more formal channels. Emails are always copied, or should be usually copied to the rest of the council, so you don't have that issue. You and I, as well as many of the active council members, we're going to talk to individuals on a regular basis no matter what. But it's going to be up to the individual council members, I think, to realize when it gets to a level where maybe this shouldn't be me speaking, maybe this should be the council speaking as a whole. So if we establish some kind of policy where we can recognize that.
Right. Mr. Hastings, did you have a comment?
I was just going to say that I wholeheartedly agree with Vice President Cannon's comments there and Mr. Davis's comments. I do think, I serve on the board of the Metropolitan Planning Organization as well as Shore Up. There's often a lot of conversations a lot of questions folks have for Shore Up and others. I don't think I would want to be feel like I'm all-footed, and not being able to know what's happening or what other. I'd rather folks would come through me as the board representative or as a representative from the council on those boards. So I agree, and maybe also just say it might be good to help. We want to make sure that we have the kind of environment where folks like that, we get the library director or whomever, they feel comfortable requesting coming before the council. We want them. I think we want organizations to feel like they're welcome and that they could approach the council to come say what they're thinking or feeling, or yeah. I'll leave it at that. Thank you.
Okay, Mr. Holloway.
So would this work both ways, Mr. Cannon? Would it work both ways as saying, well, the library members can't call up the council people and ask for information and direction or support for different projects privately?
I think anybody can contact any council person they want to. It's up to the council person to decide whether or not it's a formal action needs to be taken on the part of the council, or whether that council person can help address their concerns individually.
So it's okay for, and we won't use, I'm just using the library for an example here, not specifically them, but it's okay for a member of any other board or whatever to contact council people and ask for direction or ask for support, but it's not okay for a council person privately to contact those members of a board and do the same.
I just think that if that were to happen, we're talking about general policy as a whole. I think if a council person would do that, they need to be careful as to how they address it. I will tell you, and I had a conversation with Ms. Teagle during this whole process, and when she was resigning, I was saying to myself, man, I hope I didn't overstep my boundaries in trying to explain my opinion. I felt like maybe I had overstepped. So it may benefit all of us to take a step back and just be very careful as to when we're addressing issues that we know might be confrontational, maybe to back off a little bit and just say, look, this is, the council has a policy. Let's leave it up to either the council as a body or the liaison to address it. But no, Joe, I mean, any constituent, whether they're part of an agency that we fund or not, any constituent certainly has the right to call any council person they want to.
You're saying a council member shouldn't have the right to call them?
No, that's actually correct. I mean,
that's what you're saying.
Right.
You're saying that. You're saying we shouldn't do that.
Please don't. I don't want to get antagonistic about
I'm not getting antagonistic. I'm just saying, you're saying that we shouldn't do that. I'm not, whether it's the library, the Board of Ed, or any of the fire departments or anybody in the county. You're saying that we shouldn't do that as an individual council person, but it's okay for it to work the other way. It don't work that way. We're elected by the people of this county to ask questions. I mean, I've been through it with the Board of Ed since I've been on the council, and get put off every time I ask a question just about, So I've been through it. And I've not been through it with the library, but I have been through it with the Board of Ed. So, the people of this county that elect these council members expect us to ask questions about how the money's being spent. And I don't think we should tie our hands.
I'm going to just address that. And Joe, you said we are elected by the people, and we're elected to serve the public. So anybody can ask questions to us as citizens. We're here to serve them. Now, how we serve them and those processes, there's a lot of cases that, it's how we communicate is dictated. We don't necessarily have that same, we just can't question anybody. There's a lot of guidelines and actually regulatory that we have to follow. So it is different for us when we reach out to organizations. Just a simple fact in the charter, we can't approach a department head.
We can approach a department head, Bill. We just can't give them direction on what to do.
Right. But that's my whole point. We just can't do anything as representatives. We don't have that luxury. A citizen can ask us anything they want because we're here to serve.
But I'm not talking about county employees now. I'm talking about members of a different organization such as the Board of Ed. There's nothing that says in the charter that we cannot contact them and ask them questions.
And I do want to point out that many of the questions that are being asked came from a constituent. And that's why the council person is asking that question. Am I right?
At different times, yes.
Yes.
Yeah.
So I just want to point it out.
But obviously, there's a big problem when, I'll take the example of, and Mr. Cannon just alluded to this, but, we had a, library director resign due to the amount of pressure they were put under by a council member or members. I'm a council person. I'm not aware of that. I find out about all that after the fact. Because, as a whole, our council body wasn't copied or part of these, whatever the questions were. We're not even aware of that. So that's when, that's obviously problematic as a body. We're not aware of what's going on. And it's to the extent where, it actually costs us a director of an organization. That's a problem.
Right, and I agree with you. Some of us weren't aware of the issues going on in the upcoming resignation, and that's why we're having this work session. Do we want to formulate a policy?
I email the Board of Education regularly when citizens ask me questions, and I get an answer. I don't copy the whole council on it. I just direct it to the Board of Education representative in my district. They send me back an answer.
And at one point, there was some discussion, I know it was around 2014, it was decided then that the council members should copy each other when we send out requests like that, so that we do know what's going on. That hasn't been happening in every case, but occasionally we'll see a copy. So do we need a point of contact right now?
I'm going to call who I want to call.
Ms. Holloway?
I'll repeat it. I said I'm going to call and ask questions of who I want to call.
Okay. Any more discussion? I have another question. Do we want to respond to the letter?
I think it may be a good conversation for them to come and we can discuss with them our concerns and their concerns.
Ms. Harley, can we check to see if they want to attend an upcoming meeting? Yes. Okay. Any more discussion? All right. We're going to move on to a closed work session at this time since there's no more discussion on that topic. Need a motion to convene in the closed work session.
So move.
You got a second?
Second.
All in favor, say aye.
Aye.
Okay.